Registered osteopath, and I am about to demonstrate to you how to do an SIJ adjustment, and in particular in this case, in Mick's case, he has a posterior innominate right side. What's that mean? That this is his innominate bone, comes from Latin meaning bone with no name, and commonly it will be described as your SI joint, your sacroiliac joint. So this is your sacrum and this is your ilium, and that's the joint here, your sacroiliac joint, and that's it from an anterior view. And what happens with the innominate, a posterior innominate, the innominate will rotate slightly posterior or backwards, and as it rotates backwards, it tends to pull the leg up with it in a keflat direction, causing a functionally short leg. And if the innominate was to go forward and rotate forward, it would push the leg caudad or downwards and give you what would be a functionally long leg. So, having examined him, did a standing, seated flexion test and measured landmarks, etc., we've established that he has a posterior innominate on the right side, and now we'll see if it will adjust. Okay. So, Mick, if you turn on your side to face me, just double this over like that. Okay. So, I need his right side facing up. Need the couch at the right height. I'm going to palpate his PSIS, posterior superior iliac spine. I'm going to bring this leg up and rest, the top leg up and rest it behind the knee. I'm going to bring this leg out, the lower leg out, just to tighten up everything. Change hands, PSIS. I'm going to place this hand on his waist. I'll take this arm just above the elbow. I'm going to rotate through and a little bit in the keflat direction. Okay. So just hold on to your wrist. Get a little bit of a firm grip on the wrist. Relax the shoulder, relax the hip, relax everything else. So this is sometimes overcomplicated, but I look at the pelvis or the ilium as like a steering wheel. So in this case, it's posterior, which means it's gone this way. So I want to anteriorize, if that's a word, but anteriorize the innominate. And what I view this one is like punching yourself in the stomach. So it's like a steering wheel. So my forearm is across his glute, like that. And it's like this, I'm punching myself in the stomach. You need to tighten up everything for this, so I'm winding him up like that. I'm putting a little bit of compression into the shoulder. I'm palpating the PSIS so I can feel what's happening. And if you can come in a bit closer, you see what's happening here now. And I'll get you to take a deep breath in and breathe out. That's it. And you should get one clean pop like we did there. Sometimes it won't cavitate, but most times it will. So that's your innominate adjusted. Okay, thank you.